Blood pressure is an absolutely essential ingredient for the well-being of the human being. Every cell should receive oxygen and nutrients, and to enable that, the blood pressure is really designed. And then the pressure exerted by the blood on the arterial walls that determines the blood pressure. So, in number of publications and in common knowledge, 80/120 is considered as normal blood pressure. Yes, that might be the scientific view, but our common sense do not subscribe to that view. Normal blood pressure is termed as 80 diastolic and 120 systolic. This is the common accepted scientific view. However, I, with all my apologies, object to this kind of standardization. Every individual will have his own type of blood pressure, his own type of tolerance level, and his own type of acceptance level. And the blood pressure is not one which is constant. Every 5 minutes it can alter. You remember, if you will see a snake just in front of you, your blood pressure will go up definitely at least by 50 points. And the moment snake goes away, the systolic will come down automatically. For that you don't need any medicine or you don't need any practice. The best doctor in you, that is your system, will manage all this bringing up and bringing down to the requirements of the biological system. However, one cannot discard blood pressure in a very simplistic way. When it is showing certain sort of discomforts or symptoms, we should be careful. What are the main symptoms one can expect? One is sleeplessness. Second is fear. Third is a sort of giddiness. Fourth, intolerable headache. Fifth, nausea. Sixth, anorexia, and so on and so forth. But the most disturbing symptom is pedal edema. That means your kidney is in trouble. In majority of the cases, even by certain medicines employed to tackle high blood pressure, pedal edema can result into. But that the doctors can very well tell you correctly whether it is due to any kidney problem or it is due to introduction of medicines to lower the blood pressure. Swelling in one foot or both the feet is called pedal edema. Always it is related more or less to either the heart or the kidney. Hence we are giving importance to control the BP, which is one of the components which can lead to the disturbance to the heart or to the kidney. Here we may have to start a medication if warranted for controlling the BP. Major health problems like heart problem, BP, diabetes, kidney problems, all these things can be to a great level be attended by modifying our lifestyle. Lifestyle is your exclusive propriety. Hence, more importance must be given in changing the lifestyle for your own benefit. Here, what are the things one can think of? Always, the sodium is the major culprit according to the medical bulletins, doctors, and professors, publications. But I beg to differ. By reducing sodium, in fact, you are inviting more problems rather than solving the high blood pressure. You concentrate also on potassium. The diuretics employed and many blockades, the calcium blockage, channel blockage, all those things, this can all lead to number of associated side effects or problems which is worse than the blood pressure itself. So while going to start the treatment, one should be fully aware that you are eligible to receive that kind of medicine to safeguard your life. Otherwise, always one can have a second thought. Lifestyle changes when advocated. I am referring here the food regimen, exercise, stress management, rest, and outlook. When coming to food regimen, it is always complained that salt is the main culprit for the high BP, and I have seen number of doctors advising people to avoid or reduce salt, and a number of them come with different complaints of nausea, vomiting, reeling sensation, not able to stand up, and so on and so forth. So it is not have a blanket approach when salt is discussed. So I suggest that everyone must avoid direct salt, avoid as far as possible chemical salt, and rely more on natural salt. What is natural salt? Natural salt means the number of our food items contain natural sodium. For example, red rice, it is having sufficient sodium, and you need not add further sodium to cook that rice. But we have seen often that people add the salt and then cook the food. Just makes little change. You cook the food and then add the salt. Automatically you will see a drastic reduction in the total intake of salt. Then coming potassium. Potassium is absolutely an essential ingredient to maintain your BP. But by usage of diuretics, your potassium level comes down and you expect to maintain your BP. It's all contradictory in nature. So have a judicious approach. Third most important thing is that always rely on natural food. Natural food available in your vicinity, not that one imported or that one you have not seen. Avocado, number of people used to suggest, which is not available generally in India, or if available, very few people can afford that. So affordability should also be a factor while deciding your food regimen. Second, as far as possible, kindly avoid frozen food. The fridge, there is perhaps, especially in urban area, not a single house where there is no fridge. It is for our convenience and comfort, no doubt, but it should not destroy our health by enjoying the food kept there for days together. At the most 48 hours you can keep some cooked food, not more than that. And avoid deep frying. Okay, you can have dosa, but you cannot have medu vada. You can have potato curries, but you cannot have potato vadas. And similarly, you can have chapatis, you cannot have puris. This kind of minor changes, which will not reduce your total calorie levels, but the quality level will change, and it will help to maintain a standard BP in many of our brethren. To maintain a quality blood pressure, you should also resort to daily exercise. These days we are reluctant, except in few cases, to indulge in good exercise patterns. Simple walking or cycling is sufficient, but even that has become a problem. But we are deprived of time. We are running helter-skelter, in which you don't find time to live. You don't find time to eat, to do exercise, to rest, to sleep. What a pitiable condition. And who can correct it? Not the doctors, not the medicines. It is you. You can correct it. You can have a review, implement it, and see what happens. Still, if it is not under control, yes, there is something wrong, which we can investigate. And equally important is to get a good sleep. Only exercise will not create a conducive condition. A proper sleep, proper rest, all these things are equally important. Now, let us say another area where one has to be very vigilant, that is stress management. Stress management is a tricky question. See, stress is not our birthright. Stress is our creation. The hell and heaven, they do not have boundaries. It is within your mind whether you have to create a positive condition or a negative condition, whether you have to run away from a scenario or you have to stand and argue on the point. You have to whether love your family or you don't spend time for their family, whether your employer is a good one or a bad one. And if your employment is giving you enough headache, you can always try for an alternate employment. Perhaps it is not very easy to find out alternative employment, but it is equally important that we have to maintain our proper health. And this is definitely possible, at least for a large number of people around us. Please take note of that. Should be an addict to the medicines to control the BP? Definitely not. We should try to come out of its clutches, and it is possible without endangering your life and your health. Please think twice before continuing long-term medications for high BP. Its side effects are worse than the BP itself. I indicated earlier the pedal edema, a certain type of cough, fatigue, dizziness, nausea, and anorexia have been reported by constant use of number of medicines. Let it be calcium blockage or channel blockage or diuretics. They all are having its own disturbances. When have seen the heart patients, more than 50% of those with the problems have told that they are continuously taking BP medicines. If BP medicines will protect your heart, if BP medicine will protect your kidney, then there is no room for such complaints. So let us have a free, frank thought in these lines. Oversimplification or discarding the medicines altogether is not my aim here. It is to review whether that kind of interference is needed or not. When you are having a creatinine problem, if you are a real heart patient, if you are a diabetic, perhaps it is always wise to maintain the BP in a desirable level. In that extent, definitely you can seek assistance if you feel it necessary. Oversimplification or avoidance of medicine is not my motto here. If really one is facing some serious problems like kidney problems, it means more of creatinine is noticed and the patient is under dialysis, or one is a heart patient or suffering from diabetes, it is perhaps necessary to keep the blood pressure within the range. Okay? We can definitely take the help of the doctors or your well-wishers to check your BP regularly if it is so needed. But regularly taking BP also brings a suggestion, an automatic suggestion that you are suffering from BP. Please don't convey that kind of feelings to your subconscious mind. You might have seen white collar BP. The moment the patient goes to the doctor, the BP is very high, and when he comes out with a packet of medicines, his BP is normal. It is not unusual. Number of patients I have seen with this kind of conditions. There are so many other simple, short-term difficulties encountered by the people suffering from high blood pressure. One is the temperature parameters. If one is going to a cold region, automatically the arteries will narrow and more pressure has to be exerted to reach the oxygenate blood and nutrients to each and every cell. And again there can be a condition where the total fluidity level on the system is sharply come down. That is, sometimes we may be on a travel or a sort of religious fasting. Many times, without our knowledge, the fluidity level of the system can come down. That is, we may not be taking adequate water. Adequate water does not mean more than the required water. More than the required water will drain out your sodium and potassium. Be careful about it. Yeah, my video is not exhaustive on the subject. It is only certain valid, important points are covered here. So always there is enough room for further consultation and further assessment yourself. I shall be coming to you again with next episode on diabetes. Till then, Dr. Sukumaran, we shall meet again. Thank you.